As we mentioned yesterday here, Boston has already started setting up tents outside homeless shelters in the city to serve as makeshift clinics to test and quarantine those showing signs of coronavirus. With limited access to hygiene products and running water, the city's homeless are especially vulnerable. And in shelters, some of which house hundreds of people at a time, the ability to social distance is the ultimate challenge. The Pine Street Inn, New England's largest shelter with room for more than 600, is working hard to protect its guests. President and Executive Director Lyndia Downie joins me via Skype. Lyndia, it's great to see you, as always.
Thanks, Jim.
You are dealing with a vulnerable population in normal times, and that population obviously is made even more vulnerable in these abnormal times. What are the top challenges you are facing?
Well, I think the very first challenge is that many of our guests have pre-existing medical conditions. They're older, and so they're highly vulnerable to the most devastating form of this virus. And at the moment, it's hard for large shelters to do adequate social distancing. And we are working very closely with our great partners, Healthcare for the Homeless, with the City of Boston to both screen, then test, and then quarantine people. But we are still working with the city and the state to find quarantine sites because, unlike everyone else who can self-quarantine, the people that we work with cannot.
Have you had anybody test positive yet or no?
Not yet.
And if you do have to quarantine someone, should it occur, are these tents that I mentioned a minute ago at least the interim step? Is that the interim solution to the problem or no?
There's two different types of tents being set up, Jim. We have tents at all of our shelters where we are going to start screening at scale tomorrow, where we will do a questionnaire and a temperature check. Based on that, we will then refer people to testing. So those are what I would call a screening tent. We then have a tent that the city and Healthcare for the Homeless has set up down on Southampton Street, and that will be a quarantine and isolation tent that will be used for anybody who tests positive and be used as we do contact tracing for anybody who's had exposure.
What happens if someone's quarantined and has an addiction? How is that dealt with?
Well, that's the reason for the tent. We will be working actively with those folks to help them out with their addiction, whatever we can do, whether it's offering medicated assisted treatment on the spot, we hope. Boston Medical Center has offered to help with that. We're going to do our best to help people who need a drink, frankly, so we can keep them quarantined. Sure. We're trying to think of everything we can to make sure people can stay in one of the tents.
Are you comfortable that their tests are available if you were to need them?
I think the tests are available, but the turnaround time is very slow. And the reason that matters is if a pending test takes a day or two, we can turn around the quarantine beds very quickly if people don't test positive. We don't want homeless people ending up in hospital beds if they're not sick because they need to be quarantined, taking a bed away from someone who might need a bed with a ventilator who might be seriously ill. So the test turnaround time is not helping us at the moment.
How are you sharing information on things like social distancing with the guests at the Pine Street Inn? How are you communicating that? And what kind of, particularly when they're in such close proximity, how are they taking that message? What's their reaction?
For a couple of weeks now, we have had posters up. We're handing out flyers to everybody who comes in about hand washing and social distancing. We have almost completed putting what I would call kind of a very thick plastic shower curtain around our beds, a clear shower curtain to help with any droplet spread. And the guests are aware we're starting to screen. I think they've been grateful for it. They're just as worried as you and I are about this epidemic. They understand they don't have a lot of options and their choices are so limited even before this. So I think for the most part it's gone well. We've had a couple of people say, why do I have to sit at the end of the table and my buddy's sitting, at the other end of the table? Had some of that, and we've walked people through it. So I think for the most part it's gone well, but this is going to be one of the biggest challenges that the state's going to face. What are you going to do for people who can't self-quarantine, who are going to need a lot of help, the space to quarantine, staff to make sure people stay quarantined, and then an ability to get people, back to shelter once their tests come back negative?
You know, you say one of the biggest challenges for the states. Often when I've spoken to you, I've asked you about whether or not people suffer from a terrible expression, homeless fatigue, meaning I can't deal with this anymore. Are homeless people in this state in this time of crisis getting as much attention as they need about this issue, or are they second tiered?
I think, Jim, there's so much focus right now on protecting our elders, getting our kids out of school, and getting the testing going, that I think this group has not risen to the top, frankly. The reason they should get more attention, though, and rise to the top is that it's a group that's going to be highly at risk, and a group that doesn't have the ability to self-quarantine the way other people do. And that is going to put other people at risk, not just other homeless people, other people, period. So it behooves all of us to pay attention to this and do a good job with it so that we limit transmission across the state.
You know, the numbers, I know very well, the numbers you're dealing with are immense. But what I guess is obvious to everybody is the more layoffs, the more furloughs, the more people go without income, the bigger your client base becomes. Are you worried about that potential surge? I'm sure. Are you planning for it? I mean, how are you dealing with it?
Yeah, we're full right now. All our shelters are full, from a combination probably of some people that were on the edge and, have come to us. So our numbers have not decreased at all. And in fact, we're still in winter overflow in Boston. So our shelter, the city's own shelter, we are still, people are still sleeping in cots and mats on the floor, and there is no more room. And so we have to come up with another plan for this, because we're not going to have expanded capacity. And as we get a positive case, additional homeless people will have to be quarantined, but our staff will have to go home and be quarantined for 14 days. So this is both a facilities issue and a staffing issue. And I can't emphasize enough that we need every hand on deck, that we need the state and the city working in sync with us so that we can manage this.
I want to end with, you are so modest that you're going to hate this, but you are as unflappable as any human being I have ever met. But have you ever confronted anything that is this immense a problem with no finite end?
No. Just like everybody else, Jim, we deal with lots of crises every single day. We lived through, the horrible winter of 2015 and managed to get through. We didn't lose a single person on the street that winter because of the work of all the partners in Boston. This is throwing us for a loop, just like everybody else. We are extraordinarily worried about it. We're grateful for the offers of help, but it is going to strain every resource we have, every staff person we have. Every bit of creativity has got to be put on the table right now.
Well, if anybody can do it, it's Lyndia Downie. Lyndia, thank you as always, and lots of luck. And if you out there want to learn more about what the Pine Street Inn is doing or help them in their efforts, you can visit them online at the address on your screen, pinestreetinn.org.